Greetings, D.Lorina here. Today's Friday, the 12th of December, 19, Now, let's start again. Good day, one and all, greetings. This is D.Lorina, and today is Friday, the 12th of December, 2025. Today has been a very cold day, which saw me come home and have 4 cups of tea. Now, if you have seen my face previously, from some of the dates that's been beforehand, you will see that I've gained a little bit of weight around the face. I had an emergency last week where my body just started seeping fluid. This could be caused by an allergic reaction of some sort or anything else, as I am learning. Now, it's been a week and a few days since. And if anybody knows me, they know I'm healthy. And I've been doing these health reviews every 7 days. But since the illness has taken place, I wanted to continue, but I needed to rest because I found that when I finished these reviews, the problem would be really there in your face. So it was just to make sure that my legs are off the floor where gravity is going down and that I'm resting. So at this moment, it's a crunch time in a sense where I've got to really pull my socks up even more so now. For the last 5 years, that's what I've been doing with regards to my health, just to help myself with all the complications that was going on at the one time. And today I met the cardiologist, and after the ECG, I spoke with them, and they seem to be very confident as to what is the cause. So I pray that that gets dealt with. There were just 2 things I didn't tell them, which was about like my hands, like the nerve endings. I've lost some feeling in it. My fingertips look different and they feel smooth, almost like I've been electrocuted. They just look dull, but they also look nibbed. I've never had fingers that's looked the way that these have looked, but it just feels very, very smooth. And the pain that I've been experiencing in the head, but I did pass it on to the nurse if they could pass it on, but really and truly I should have just knocked the door and interrupt and added that, but it's there. So when we have a follow-up, God willing, I will be able to just mention those 2. So the appointments are coming quick and fast. I'm not sure if my body is built enough to handle all of it. I've got an endoscopy the Tuesday. I've got a clinic the day before. They're still starting their investigations with regards to what could possibly be the cause of my swelling. I personally believed it was an allergic reaction because I've had this before back in 2012, which saw me spend 15 days in the hospital. So if I can show you now, I'm not appropriately dressed because I've got to just be comfortable where I am at the moment. I'm literally more or less on the floor. So I don't know if you can see this. Maybe if I lift up the top, you'll see. This is my back. This is my stomach. This is my bust area. And it was a bit bigger than this, but my stomach is full. there's fluid in this cavity. It goes all the way down here. Wherever the fluid can go, it will go. So it initially was starting in my feet, and it's come up to my girth. So we definitely know that there's something not right. When I experienced this back in 2012, my stomach was out here and it was hard, and other parts of the body was disfigured. But I left the hospital after 15 days with a litre full of water in my lungs, and they diagnosed me with pulmonary edema back then. So not that I'm wishing anything on me, but it's always nice to know what the issue has been so that it can be treated. And the only way that I've been looking after myself is through my diet, through my health. Now, for the last, say, month or so, I've been a little bit outrageous because I have been fasting, etc. So learning how to get back into the food of things is something that, if not disciplined and if not trained, can be out of sorts. Let's just put it that way, because cravings can get the better of you. And so hence the possible allergies. So at this moment, I'm sensitive to a lot of things. I've done my best over the last week to eat certain foods to help build my strength. So I've gone back on to the dairy products, and most probably this is part of the chubbiness, but I doubt that. But I've been having lean dairy, but that can help the protein, the muscle repair, the leakage, etc. And I'm just doing my part, which is just to make sure that the food that I eat is a lot nutritious and it does the job that it needs to do, whilst the professionals do what they have to do. So December I thought was going to be a very quiet month because it's Ramadan. However, it has become quite busy. I don't mind because we've got the ball rolling, and inshallah that can get us set for next year. So it's a good thing. I say my spirits are up. I'm positive. I'm not gonna let this get me down. The only thing I am very conscious of is the way that my body just switched, because you're not prepared for that. So I intend to, with all the hospital appointments, and it's not a lot, but this week we've got like days in a row, and we've got one just towards the end of the month. I pray, and I believe that I'll be having every week because I've already started a clinic. I just pray that I'm able to develop a different form of discipline, because the first thing everybody wants is to hear a doctor say, oh, well, you've done everything that you need to do. There's nothing more that we can do. You've done it all. I don't want that. Not that I'm wishing anything bad on me, but I haven't gone into medical studies for 8-9 years to know exactly what's going on with the symptoms that's been happening, and this is why I'm asking for the help. I can only help where I can with the knowledge that I have and the research that I do, and it's always in the food department. um, that I aim to build the body, and there's only so much that you can do. But for me, I have to soldier. I have to soldier on. During the fasting, it was a really good time because it allowed me to explore my mind. And, you know, you're giving yourself time away from having to prepare food and clean up after yourself and eat food, because food makes me drowsy. I don't know about you all, but it makes me drowsy. So it's just a sign that things have to change up. But where I was diagnosed 2 years ago with polyoral syndrome, which meant that I was allergic to pollinated foods. I mean, that's fruits and veg, that's everyday food. What I've noticed is just that in my older stage in life, my body is rejecting a lot of foods. And so I have to be careful, basically. That's all I'm kind of reminding myself. So I cannot eat from anyone. And whatever I do eat, I have to scrutinize the ingredients 100%. So um, it's a good thing. It's a good thing because it allows me to recreate. It allows me to be creative. It allows me to challenge myself and think beyond what's normal to everybody. You know, when I tell people I'm allergic to sugar, wheat, and onions, they ask me, what do you eat? And I'm thinking to myself, do you not have an imagination when it comes to cooking? You know, I think that's absurd when people ask me that question, because there's so many things you can do. But then not everybody wants to cook. I don't like cooking. I don't like being stuck in the kitchen, but I can create foods, to make sure that someone eats sensibly or I eat sensibly, and, someone else has another issue, that they can eat sensibly, because your body needs the nutrients in order to act properly. So I wanted to just jot that down. This has been the ending of 2025. But this is good because we are getting to where we need to be in order to pinpoint this problem that I've had over the last 5.5 years, if not 6 years, because 2019 in June is when I fell and I didn't have no feeling in my leg and I broke my ankle, and then from then my health had deteriorated quite quick, and I've always stuck to that because that has been the truth, and I've always brought it up because that's when it all began. So I'm positive this time around that I've got the right people, the right team of people helping me out. And it's not just one department, I've got multiple departments. So by Allah's grace, we will get to the bottom of this so I can live properly, you know? So, yeah, this is D.Lorina signing off. I bid you all a good 2026. I may be back this month, but I doubt it. I'm just going to spend the rest of this month recuperating and getting some of the works that I've done this year, because I haven't stopped working at all. I haven't stopped working, but I get some of the stuff done and ready for the year to come. So, look out for that. I haven't forgotten no one. Just been taking time on some self-love care for me. And yes, look forward to what's next. But we already are doing it. So see you then. Take care.